Matters on the adjournment. First motion, Senator Mary Moran.
Thank you, Ciarán. Thank you, Minister Lynch, for taking this adjournment debate this evening. Minister, I've raised the matter of the lack of a child psychiatrist and indeed mental health services in the area of Louth for children with an intellectual disability. I've been very perturbed lately to find that there is no child psychiatrist, and being in touch with the HSE, I've been informed that interviews have taken place for the position, but that they have been unable to fill this position. And I just find it very baffling that for the whole area, and very worrying that there is no child psychiatrist for the whole area for children with an intellectual disability. Recently I had a case of a constituent who had a child who was in need of such services, as are many children the disability services have reported to me in Dundalk, where they have several children that are in need of these services, and they haven't been able to provide this service. More worryingly was the fact that as the child in question was 16, paediatric services have refused to look at him. CAMS have refused to look at him because he's over 16. They have also said they don't have a child psychiatrist who will deal with intellectual disability. And when the child was brought to the GP, they were told, well, we can provide sedation. Thank you. I find it very worryingly, and it ties into the second part of the adjournment that I've put forward, is that there are no services, or there appears to be no services, or a difficulty in trying to get services for children with an intellectual disability, particularly in this age group. And I think it's a case, the more I look into it, that it's one department will say, well, you go somewhere else and it's not my responsibility. And it's like a magic switch comes on when they chronologically reach the age of 16. I think that exemptions and certain circumstances have to be taken in for children when they seem to approach this magic age of 16. I mean, I'd always heard about it and read about it as it's coming up, but I just find that, where are they to go? Where you can't turn around to a parent and say, well, sorry, take that child home and, do nothing. There are, if there are other family members or if there are other people there that also need to be taken into consideration, I think it's very important that, that these services are provided and that the support services. Now, in saying that, I do know for a fact that the disability services in the area are very good and seem to be providing the support for the people who need it. I've never heard anything but praise for the people who are in that. But I think that this is a matter, Minister, that really seriously needs to be looked at as a matter of urgency for the many parents that are out there who don't have a voice, who don't have a place where they can raise this issue. And I'm raising it with you, Minister, in the hope tonight that you're not, when you send in a PQ through, TDs or whatever, and you ask for a question and you get the same answer the whole time, this is a matter for the HSE, I'll refer it to the HSE. Speaking with the disability officer last week, I was told there is none, there's nothing we can do. To me, that's not an answer. You can't just sit back and say, there's nothing we can do, and that's it, until it comes knocking on your door. So, Minister, I would hope that you're going to give me some positive news tonight. Thank you.
And could I just say before I give you the official reply, Senator, that I suppose for the last 2 years, the money we've gotten for the last 2 years, and as you know, it's 20 million this year, additional development funding in relation to mental health. I actually had some people in advance of the money this year, and the two areas that we knew we had to work on this year with the additional money was in fact old age psychiatry and intellectual disability, because if you have a child or a young adult or whatever with an intellectual disability, that does not protect them from difficulties with their mental health, and there sometimes is a crossover, but you do need a very specialised area in order to deal with it. But I would like to thank the Senator for raising this topic today. This government has prioritised reform of mental health services in line with a vision for change and is committed, in particular, to the delivery of more and better quality care in the community. This includes enhancing and streamlining, as appropriate, service interactions for under-18s between the mainstream mental health and disability care programmes. Total HSE mental health funding in 2014 is in the region of 765 million, but that's the budget, not including the development money. This reflects the additional funding of 90 million, together with around 1,100 new posts that have been provided over the last 3 years to modernise our services. This has focused primarily on strengthening community mental health teams for both adults and children, enhancing specialist community mental health services for older people with a mental illness, including services for those with an intellectual disability and mental illness, and upgrading forensic mental health services in line with a vision for change. And again, I think the Senator raises an additional very important point. We have been talking to CAMHS for the last 2 years in terms of, children between the ages of 16 and 18. We cannot possibly say to people whether they have a disability or not, that somehow or another they don't exist because they happen to be in that age bracket. And I have been assured that that age cohort is now going up to 17, with a view to it going up to 18 the following years, and that has been on the back of the additional resources that we have provided. The recent establishment of a new mental health management structure within the HSE has been designed to bring greater clarity to services, including multidisciplinary care at both national and local levels. We have given greater recognition to the fact that child and adolescent mental health services, in both policy and practical terms, will eventually have a role in some cases, at least in cases of difficult diagnosis, and in terms of specialist episodic treatment of acute mental disorders. Again, this is a specific implementation requirement of a vision for change. In regard to the issue raised by the Senator, the HSE has indicated that until last year there was no dedicated service available in mental health for people with mental health issues and an intellectual disability for either adult or children in County Louth. Notwithstanding the lack of services available locally, there was, however, some support from child and adolescent mental health services, and as the Senator rightly says, voluntary organisations and disability services have been doing their best. These in turn were supported by consultant psychiatrists providing 2 sessions per week. Clearly not enough. In terms of new service development posts approved for 2013, 2 teams, each led by a consultant psychiatrist, were approved for the North East for adults, and this service is currently being established. The recruitment process to fill these posts is progressing. In addition, the local HSE are at present exploring the question of appointing a CAMHS consultant with a special interest in disability for children. This proposal is at a very early stage, and the Department of Health has asked to be kept informed of developments in this matter. The HSE National Service Plan for 2014, including associated operational plans for regional and local services, commits to a number of key deliverables for this year. As I have indicated on many occasions in the past, early, appropriate and effective interventions is key, coupled with a strong recovery-based approach for young people with mental health issues. And Senator, your raising the issue tonight will once again put the focus back on that service, and we have to ensure that when a young adult or even an older adult with an intellectual disability has a difficulty with their mental health, as I said, they're not protected from that. We have to ensure that there is a service available to them, and I will once again take it up with the Director as appointed.
Question, Senator.
Thank you. Minister, as you know, I have the height of respect for the work that you do in your department, but I can only be honest and say I am totally disappointed with the response. I think saying progressions are in at an early stage, that's grand, but for the child who is 16, how long is that? How long more is that going to take? The psychiatrist that was there retired a year ago. He was an adult psychiatrist who very kindly took an issue and dealt with disability services for children. But, speaking with the disability, the person that's over it, last Friday, I was told there is none. The job interviews have been there. They had the report back from CAMS. There's nothing we can do for that child that is 16. Sorry, we won't see him because he's 16. It's like it's a magic number, and services are cut off. And just the more I delve into it, the more parents and the more people that I've seen. And you know, God forbid there was a dreadful case before Christmas, a very, very sad case. And Minister, we can't afford to let this go. You know, the Centre for Excellence is Drogheda in County Louth. We've got a new mental health service, a new mental health unit, which is brilliant, going to open up in the Lourdes Hospital. But something has to be done. And Minister, I am pleading with you tonight to please take on board all of the children who have an intellectual disability, that they should be looked after, no matter what age they are. As you say, they can have mental health issues, and I just think this is such a serious matter, Minister. And I know, as I said, I have the height of respect for the work you do, but and I will be back, Minister. I will keep pushing it. Thank you.
I'll be very brief, just to say to the Senator that we cannot allow that gap to remain. It just cannot happen. And I will be pursuing this. And I do appreciate you raising the issue, because it really does give me the insight in a very small area with maybe a very few people, but nevertheless people that are important to us. So I will be raising this issue again with the people responsible.
I can't get an answer as to how many child psychiatrists there are. Sorry. For an intellect. So if you could, I would appreciate it. Thank you.